I don't care if you have your license. I don't care if you get your license. I don't care if you pass this program. I have mine already, so why would I care about yours? I have mine. Screw you guys. As long as I get my check, that's all I'm here for. So if you guys over there not studying hard or not doing what you need to do, I don't care. I have my license already, so screw you guys. Hello everyone, welcome back to my channel. In today's video, we will be talking about the same way how you think students or classmates, if you will, can be toxic. The professors and even clinic instructors can be toxic as well in the dental hygiene and assisting program. Let me tell you my experience. First things first, there is no one size fits all with this. I am basing my experience off of schooling down here in South Florida, where I am located. The programs that I've went to, of course, every professor has different personalities. I get that. But some are way more toxic than others. On one hand, you have the professors where, they're really professional, caring, and they're concerned about your grade just as much as you are. Even, I don't know what their base pay is. If it's a little bit, I don't know. But you can see the passion that they have for their students. For example, when there's a test, a quiz, exam, what have you, they make sure that it's on the material that was covered in class. They make sure that, of course, it's going to be on the computer, so it's easier for them to even grade it, because as you click submit, it automatically tells you what your score is. In hygiene and dental assistant school, your passing rate is like 76, I want to say, give or take. Yeah, for sure. And what I'm saying is, for the instructors that care, okay, well, I'm going to make sure I give them at least 15 to 20 questions, 25, because of, obviously, what I'm saying is, the more questions that you get, if you get some wrong, is not going to hurt you. The fewer questions that you have, you got to make sure that the questions are correct, because if they're wrong, it's easier for you to fail. The professors that are sweethearts, you'll know them. They're caring, they're nurturing, they'll go over with you as many times as you need to go over things. They're there for you, they've got your back. Thick and thin, they've got your back, because believe me, any level of dental school is going to have its challenges. But they're there for you, and they hold your hand every step of the way. They are there for you. Now, this video is talking about the toxic ones. The ones where you're like, how is the instructor still working here? Yeah, that's the purpose of this video. I've had instructors where they will literally tell you, okay, how did you get into this program? I've had instructors tell students, oh no, you will never be a dental hygienist. Oh no, you'll never even be an assistant. I've had instructors where, oh no, well, I don't get the pay that I feel I deserve, so I'm going to test you on whatever I want to test you on. I've had professors state, okay, well, although the tests are online, but they purposely give you only a few questions, and then it'd be on something where it was like something where they didn't even really discuss or didn't even touch base upon. And then, oh yeah, well, they'll base their quizzes off of that. Because in hygiene school, assisting as well, there are tests, sometimes there's back-to-back. Sometimes you'll get even 2 or 3 exams and the same, because you have your clinical days, you'll have your lecture days, or theory, if you will. Like I said, based upon whatever region that you're going to school in. I didn't like the professors where there's so much material to cover. Every exam, every quiz, whatever, 10 questions. You get 3 wrong, what is that? You see what I'm saying? Versus a lot of material to cover. There's 20 questions, maybe 30, give or take. If you get a few wrong, it won't really hurt you, because they're trying to help you pass. I'm telling you now, if you think, oh no, assisting school or hygiene school will be a walk in the park and it's peaches and it's roses and this is going to be a beautiful experience, the professors are going to care for me, they're going to care for one another, you may have that experience. And if you do, congrats to you. But if you don't, I'm telling you the truth behind the peaches and roses that you see from other YouTubers. Let's say that. That's one thing. Now it's the comments. I remember I had one instructor. Every single afternoon, because class was at 1 o'clock in the afternoon. Every single afternoon. Hey guys, who saw the new Game of Thrones show or episode that came on? Oh yeah, wasn't it great that such and such did this and such and such? And then as the clock strikes, let's say 103, even if it's 101. Okay, because okay, whatever, the test has started. It's like, they're like, a lot of them can be like Dr. Jekyll and Mr. Hyde. And what I'm saying to you is, do not get so worked up on their friendly side that you're like, oh no, well, I speak with Professor Sanchez like this all the time, so although I probably didn't do well on exam number 2, but it's fine, she's gonna pass me and we're gonna be okay. I'm here and I'm making this video to tell you that if you think, oh no, well, it's fine because we're tight, we're cool, and after class we go get coffee and whatever, they will still fail you. They will still fail you. For the third time, they will still they will laugh in your face and smile with you and kiki, and you think that you guys are cool and you guys are okay. They will still fail you. So don't think, oh no, well, they're my friends, and not necessarily friends per se, but oh no, well, we're cool, and you know, I feel like although you didn't pass a few exams, but you'll make it, you'll be okay. Guess again, my friend. This video is like, I need to label this video PSA announcement, because a lot of these teachers, like I said, just like the students, can be toxic as well. Oh no, professor, wasn't the exam supposed to be on chapters 2, 3, and 4? Next thing you know, it's on 6, 7, and 8. Oh no, well, I'm sorry, I got the chapters mixed up, but oh well. Read the syllabus. Read the syllabus, and it says, okay, well, it is on 2, 3, and 4, but then it's still testing on 6, 7, and 8. It'll just be stuff like that. Another thing, in hygiene school, assisting as well. So, any level. You have something where when you're taking lecture or theory, you may have the same clinic instructor. And it's funny how, once again, with Dr. Jekyll and Mr. Hyde, oh no, well, when the lecture, they're super cool, and they tell you, okay, well, this is going to be on the exam, whatever. But when they get to clinic, it's like, that's it. This is what you have to do. Those instructors are fine with me, because you need to not make mistakes. Because you're in someone's mouth. You don't have a lot of room to be working around and playing with. You need to get this down pat. You're going to go on the road. You're going to be working in this field. You got to get this stuff down pat. And I get that. That's fine. What I don't like are the professors who overlook things in the clinic. You're doing things wrong. They're not really correcting you on what you need to be doing to get it right the first time, to pass your boards the first time. But then they're over there like super strict in the clinic. So it's kind of like I'm saying, I just want to open up your eyes into and look beyond the peaches and the roses that you see all over TikTok and all of that. I'm here to share with you. Open your eyes. Study hard. Keep your eyes open. Because although, just like you and I, how we're all fellow students in this, and we all have our own personalities, guess what? So do they. And that's cool. We're all human beings. But what I'm saying is, if this is your profession where, okay, you're going to do anything dental, you need to say, okay, well, you know, I want to ensure that my students are understanding the material being given to them. So if we're doing oral pathology, okay, I need to make sure that, okay, if it's everything's sold on chapter 2 or chapter 3, even 10, because most chapters, when you do oral pathology for the dental hygienist, you will probably get give or take 10 chapters. I think the entire book is 10 chapters. Comment below if I'm incorrect, but I strongly believe that oral pathology for the dental hygienist is, I want to say, is 10 chapters. So every single week we will get one chapter. I believe chapters 3 and 4 might be a little bit long. No, I think it's 3 and 5 that are a little bit longer. So it's split into 2 weeks. But anyway, you know, I'm sorry, I get off topic really easily. But what I'm saying is, it's like, we understand that No matter what level of schooling it is in dental, it'll be difficult. But I just don't like the fact that it's like some of them try to purposely make you feel because they're not getting the pay that they need to be getting paid. So it's like, okay, well, I do what I want. I may see where they're coming from, but I don't agree because I feel like you gotta understand. In most any level of dental schooling, there's no okay. Well, I'm working, so I don't really care about how long I have to study, whatever. That's not the case here. So if people are taking the time out of their day and taking the time from their jobs to do something to better themselves, you want to help them out along the way. You understand? I as well. I also would like to add. A lot of the times, I don't like the comments that some of them make. Nothing racial, but just things in terms of um, making you feel like, why did you join the dental profession? I don't like it because I feel that if you're an instructor, you gotta understand that you have different personalities when it comes to the students. Some may learn faster than others. Some may learn a little slower. And I don't like how a lot of the times they just take the faster kids, the faster students, and just run with them, and they're the favorites. And that's another big thing. And assisting in hygiene school, they're gonna have some favorites. Because I remember when I was in assisting school, I was considered the favorite, and I sensed that the other students envied me. I have another video on that, so I won't get too much into that because I don't want this video to be too long. I just want this video to be a PSA for those of you who are starting the program, who are going to start the program, and you're like, you just want to get like that what is it really like in regards to the professors. I'm here to tell you what I have experienced, because I just feel like, oh no, well, you'll never make it. Go ahead and drop out of the program now because you'll never make it. I don't like instructors like that because they should say, okay, you know what, hey, what's going on here? Granted, nobody's here to baby you. No one is. But if you see that a few students are struggling, okay, like, what can we do to make this better? What can we do to improve your grades? What are your study habits? You will have professors like that, but in most cases, you will not have professors like that. You will not. So I'm here to tell you and to share with you, don't be too friendly and buddy with the professors, because they'll smile in your face. Oh, hey, yeah, let's go get coffee. Let's talk about Game of Thrones. Let's talk about like all the hot shows like the Grey's Anatomy and 911 and not Lone Star, 911 Lone Star, or The Resident, stuff like that. But then they're over there failing you, like, okay, well, I don't really care. And I don't know if it's like a not a marketing trick, but like a psychological thing to make you feel like, okay, well, that's okay. I don't have to study hard because I'm cool with Professor such and such. I'm cool with Professor Moses, whatever. You understand? So I'm here to tell you, once you enter into these programs, especially dental, I don't know about nursing, whatever. I don't know about those. But in terms of dental, don't get comfortable with the professors, because guess what? They are not your friends. They are not your friends. They are not your friends. I don't know who's worse, the professors or the toxic students. I don't know who's worse. But I'm here to share with you, be careful. You got to be careful. You have to be. To end on this, study hard, work hard. Work hard in the program. When you get into clinic, ask questions. Try to remain on their good side. If you're in hygiene school, please find your calculus. Please use your double-sided mirrors. Please use your loupes. Your eyes, your back, and your wrist will thank you later. If you are in an assisting school, please know all your setups. Please know your setups. Understand what your doctor wants. If your doctor speaks quickly, if your doctor always demanding orders, write it down. On that note, thank you guys for watching. Comment down below if you've had a toxic instructor. Comment down below, because they will give you a run for your money. You're talking about us students give us a run for their money? No, they will give you a run for your money. understand that they are not your friends. We're paying a lot of money to be into these programs. So you gotta be your own motivational backbone, if you will. Because guess what? They're not gonna be. Out of 6 or 7 instructors, you might find maybe 1 or 2 that's actually gonna care. I'm just being honest here. Just being honest here. I love you guys a lot. Thank you for watching, and I will see you in the next video. Bye bye, my dental darlings. Take care.